this is what I've decided to do, coming into office, to bring things forward. And the first thing is to ask Baroness Casey Louise to bring forward her review by a year. So working with Yvette and with Angela and other colleagues, we want to expedite that review. We ideally want to do it even sooner, but we've got to be realistic. But if we say a year from now that we have that independent review, then I think we can rise to this challenge with the urgency it requires. So that's the first announcement. And let me also just say something about what I want that review to address. I go back to what we proposed in 2010, and Phil Hope was Minister at that time, a national care service. A national care service. Well, why do we talk about that? Because we need to talk about a system that can become highly integrated with the NHS. Social care is different. It has to be person-centred. If it's not person-centred, like the brilliant care provided here at Jewish Care, then it won't be what people would recognise as social care. You don't want to over-medicalise care, but it has to be very integrated with the rest of the system. It has to be preventative in its character. It has to be person-centred. And that's what we're asking Louise to give us her report on. How do we deliver a national care service in England that sits alongside the National Health Service, works in a similar way, that is highly integrated and can optimise the journey of a patient. If a patient's leaving home to hospital, back as quickly as possible, and there's no delay. We also then ask for a principle of home care wherever possible, so that we have an approach that supports people where they should be and often where they want to be, rather than ending up in a hospital bed. So how do we deliver a national care service? And there are different ways of doing it. You could do the fully fledged version, or you could do a lesser version, and you could do something in between. And then you have the question of how you pay for all of those options. But that's the stuff of the review, and the big conversation will feed that review. And again, I would ask everybody to engage with it in that way. The second announcement is to immediately, and not wait for the review, focus on the social care workforce. We already have a situation where the government has agreed a fair pay agreement for social care staff to come in financial year 2028-29, and that is a major step forward. And I pay tribute to Keir Starmer, the Prime Minister, as was when that was brought forward. That is a massive building block of a national care service. And what I'm going to ask the ministerial group led by Yvette, Angela and John Healey joining too, will be to look at how we turn the fair pay agreement into a bigger reform to improve the social care workforce, to lift it up, to lift it closer to NHS standards, in fact, to integrate it more with the NHS workforce, and actually to start to think about progression routes for young people coming into social care, so they can progress from social care into NHS positions as well, and think about it as one workforce. We will not get the care service we all want until we improve the strength and the capability of care at the very front of the service. And that means lifting up the social care workforce as best we possibly can. Yes, in terms of pay, but also in terms of training and the wider support we give them, the security of their roles. And that is the commitment I'm giving today. That is an essential enabler of the reform that we wish to see. The third announcement is to start right now initiating cross-party talks on social care. And yes, I have been here before, and yes, I do have some of the scars of that, but it's the right thing to do. I stood on the steps of Downing Street just a few days ago, and I said I wanted to create a new way of doing politics in this country. More problem solving, less point scoring. And this is the first big test of that. And I mean what I say. We won't fix this through politics as usual. We have to bring a different approach. And I'm really pleased that today I've invited both of the main parties that have written to me to start those talks. And they will begin later today. And the thing is, if you know me and you know what I've said on this issue in the past, if you were to search what I've said about social care, you will see it all, and you will, some of you are writing stories about what I've said. And I stand by what I've said. But here's the point. Ed Davey was right about this morning. We're all going to have to give and take here, aren't we, if we're going to get to a solution? We're all going to have to listen to each other, something we don't do particularly well in politics. Actually engage and listen to other perspectives. We're going to have to find common ground here. If this is to be a lasting solution, it requires common ground to be found. And then ultimately, you would hope, a new social consensus can emerge about social care. So all of that is required if we are to get there. And that process starts today. It will run alongside the other streams of work that we are doing, but I will work closely with the other parties who want to be involved to have that conversation. But what I would say in closing is I'm not going to be deflected by the point scoring or the screaming headlines that comes out of that point scoring. That is what has set back social care. And I come back to this point about the political culture of this country and the media culture of this country. If we're trying to shut down the fact that you have a serious debate about an issue like this, if that's what that is trying to do, well, it's shame on all of us if we let that happen, if we say, well, I'm not brave enough then to go into that. Well, I'm just not going to kind of do that in my time in office. I am making this a test of myself, whether I can bring forward a solution, and that is what I want to do. I would never forgive myself, ever. Who knows how long I will be in this position, but as long as I am, I will do my best to find a solution. And I would never forgive myself if I left without having tried, because of some of the headlines that will inevitably appear and some of the efforts that some people will make to create scare stories about the whole issue. Well, you can't create scare stories when people are already scared by what they're seeing anyway, through their own eyes, in their own homes or in care homes. You can't create scare stories for the staff when they're kind of living the life that they have to live. They kind of see it anyway. And, you can have as many headlines as you like about this tax or something else. But when people are losing hundreds of thousands of pounds, everything they've worked for, well, what about them? And it seems that those stories don't really often think about the people who've already lost far, far more, and that indeed almost lost everything. So that's the way I'm coming at it. And I'm no doubt more of those headlines will appear. But I'm just going to be really clear about this. I'm going to stick this out. I'm going to back Louise 100% in what she is doing and her review. I'm going to back Yvette, Angela, and all of the ministerial team as we face up to this together. We're going to do it with strength. We're going to do it with resolution. I'm going to work and reach out with the other political parties, and that's not just a kind of passing statement today. That's a commitment that I'm making today. And why am I going to do it? Why am I going to do all of those things for my dad and the millions like him up and down the country? Thank you very much. So, looking right in.
Sam Coates, Sky News. I was hoping to get your instinct on a couple of areas of the social care debate. Do you think that you can only get funded care if you've got assets of less than £23,250? Do you think that figure is now too low? And do you think the fact that 85% of care homes run on a for-profit basis, do you think that figure is too high? And I hope people in the room don't think that this is crass, but it's a linked topic that is linked in the minds of the public. What's your position on assisted dying?
OK. 23,500, I think, is the threshold. So just so everyone watching knows, if people are, whatever you've got, home, pension, savings, can be whittled right down to that floor. And that's why I talked before about hundreds of thousands of pounds being on the table, on the roulette table when people go into a later life, and who knows what can happen to any of us. I think social care in England is as unfair as American healthcare. The vulnerable pay with everything, and it can completely leave them with nothing. And that flaw has been in place for a long, long time, and common sense says it can't be fair. Obviously, the Dilnot report looked at that, at those issues, but we're 10 or more years on from Dilnot now. So, those issues will have to be looked at. But it's not the case that the funding and the paying for social care is the only issue. As I've said before, there's a whole other set of issues here that have to be considered. I think the review should look at practice across the system and where the best care is to be found. I'm not saying today that one sector is too big and therefore it will need to change, but we do have to be sure that there isn't profiteering in the system. I think that is where we absolutely draw the line. There are good organisations in all sectors, but what we cannot accept is money being taken out. And we actually do see that happening, not just in adult social care, we see it in children's social care too. And I think we do need to kind of make some changes there to answer the question that I was answering before about making the most of the money that we've got. And then let me come to your third point, Sam, my position on assisted dying. I take the view that that debate, and I don't say that there shouldn't be a debate at some point about those issues. Personally, I think there's something that needs to happen first, and that's the fixing of the funding of palliative care and social care. I think it is very challenging to introduce that wider debate in a context of people not receiving that care and having the peace of mind about that care. And that's the way I kind of see this, and that's the position that I will stick to.
Ashish, what do you make of how and what Andy Burnham had to say?
Well, I thought he was genuine, authentic, earnest, but we didn't really get a sense of how he's going to fix this broken system. So the intention is clear. Andy Burnham recognises that without fixing social care, you can't fix the NHS. There was that very clear example of patients who are in hospital, fit for discharge, but can't be discharged because there is no social care package for them. So if you have thousands of patients in hospital who need to leave hospital, that means the thousands of patients who are coming into hospital simply can't get to a bed. And that's why you have this crisis of corridor care. That's why you have accidents and emergency rooms which are overflowing because the flow through the hospital stops. This is a problem that needs to be addressed. Andy Burnham recognises that. He's a former health secretary. He is the son of a father who is living with dementia. He recognises the burden that dementia places on society, on families, and that burden needs to be shared by the state. But we didn't get an understanding of how this would be costed. It is going to cost billions to fix social care. And what Andy Burnham says is we can make savings, we can make efficiencies, we can make sure that the money saved by the NHS is ploughed back into social care reform. But he didn't really say how, when he was asked, will people still have to sell their homes to fund social care? He said, in an ideal world, no, but this isn't an ideal world. And we need to understand what Baroness Casey will say in her review. That's been brought forward by a year. That was supposed to finish in 2028. She began in 2025. Now she's been asked to bring it forward, and that will put the framework around the costing of social care. Will people still have to fund part of that social care? Which model will she opt for? How much will the state pay for? How much will be left to the individual? He's also right to tackle the workforce issue. This is fundamental to fixing social care, and that's something which can be done quite simply. He says there will be no extra cost involved. It will be funded through the existing budgets, and that's important. Care workers are an unpaid workforce. They're an unpaid army of people who prop up the care system. And we really need to recognise and reward what care workers do. If you do that with a proper training programme and it feels like a rewarding career, then you will attract more people into the workforce. But certainly, this is just starting the process. This isn't how he's going to fix social care. It's telling people we need to fix social care and that I am honest about doing it.
Ashish, live in our Westminster studio, thank you so much. Well, let's take you back to North London, where our deputy political editor, Sam Coates, was at the speech, joins us live. Sam, what was your sense of the content of what Andy Burnham had to say? He made the point that he was speaking without notes, but he also had an awful lot to say at the same time.
Andy Burnham has set social care as pretty much a top priority for his premiership. He has made it clear that he will expend a lot of his own personal political capital. He won't make the mistakes that he admitted he makes in the past, pushing the debate about what to do with social care and how to fund it too close to a general election. Instead, he, beginning today, is going to have cross-party talks and try and work out how to fix what he regarded as a social care system as broken in parts as the American healthcare system. That was the line that he used, designed to hit home about the scale of the problem that he sees. Now, very narrowly, in terms of what we learnt that was new, he's accelerated the review that's going on by Louise Casey, which was begun under Keir Starmer. That will now report in about a year's time rather than in 2 years' time. He's going to make improvements to the workforce, try and integrate that more closely with the NHS, which he wants to bring the new National Care Service much more closely to the NHS.